Okay, let's dive into this. Welcome to today's Explainer, where we're going to completely unpack the chronological journey of becoming a Unani doctor. If you've ever been curious about traditional medicine systems and exactly how they integrate into modern healthcare careers, you are absolutely in the right place. We are going to trace this entire path, literally step by step, from the classroom all the way to the clinic. Here's a quick roadmap of what we're covering today: what Unani medicine is, the educational pathway, financing that education, your daily work environment, career growth and income, and we'll wrap up with some real-world success stories. So, starting with part 1. What exactly is Unani medicine? To really get this, we have to look at the official definition from our source material. A Unani doctor is essentially a professional physician who draws their knowledge from the school of homeopathy. They diagnose patients and administer Unani medication. But here's the absolute most crucial takeaway. These treatments are officially recognized by the Indian Medicine Association, right? So this isn't just some fringe alternative practice. It's a highly formalized, institutionally recognized medical profession. But, before we get bogged down in the heavy academics, let's do a quick vibe check. Take a look at these traits. Do you genuinely love helping others? When you're working on something, are you naturally the person zooming in on the fine details? Do you actually thrive on solving complex problems or getting out of tricky situations? If you're nodding your head right now, then you already possess the foundational personality traits that make for a fantastic Unani physician. Moving right along to part 2, the educational pathway. Because once you have the traits, the next step is the training. If you're a high school student right now, listen up, because this is where your journey officially begins. Your foundation starts at the 10+2 level. You absolutely must be in the science stream, specifically focusing on physics, chemistry, and biology. Once you knock that milestone out, it's on to higher ed. You're going to need to complete a bachelor's degree, which is an MBBS. Or if you're someone who wants to specialize even further, you can follow that bachelor's up with a master's degree, an MD, in the same field. Now, you can't just casually sign up for these programs. You've got to prove yourself through some pretty rigorous entrance exams. And what's really interesting about this slide is the sheer variety of pathways into these medical programs. Depending on your specific degree and level, you'll be looking at clearing exams like NEET, which is conducted by the NTA, or maybe NEET PG or NEET MDS from the NBE. There's also the AIA PGET for certain postgraduate placements. It's a tough academic gate for sure, but it ensures that only the absolute most dedicated students move forward to treat patients. Which brings us to part 3. Financing your education. The big question: how do you actually pay for all of this? Let's start with a quick reality check here. The approximate course fee is going to range somewhere between 50,000 and 6,50,000 Indian rupees. Now, keep in mind, these are estimated figures, and they will vary wildly from institute to institute. But yeah, seeing that upper limit can definitely be a bit intimidating for a prospective student. However, do not let that price tag discourage you because there are so many concrete financial solutions out there. First off, you've got the National Scholarship Portal, basically a massive centralized hub for government schemes. A ton of institutes also offer their own merit-based scholarships. If you need a loan, the government actually created the Vidya Lakshmi portal specifically for students. Plus, certain states like West Bengal, Odisha, and Bihar offer dedicated student credit cards with pretty low interest rates. And of course, general education loans are available from all the major banks. The support structure is absolutely there if you just seek it out. All right, part 4, your work environment. After graduation, where do you actually go? One of the best things about this profession is the sheer diversity of places you can work. You could find yourself working for an NGO, deep inside an academic medical institute, or on the front lines at a government hospital. You can work in established clinics, or hey, if you've got that entrepreneurial spirit, you can build your very own private practice from the ground up. I also want to point out a really encouraging detail from the source material. There are actively noted opportunities for differently abled individuals in this field, which makes it an incredibly inclusive career path. But let's stay grounded in reality for a second. Medicine is definitely not a breezy 9 to 5. You have to be totally prepared to work at least 8 to 9 hours a day, 5 to 6 days a week. And because healthcare is a 24/7 necessity, shift duties are just a standard part of the job, and overtime is incredibly common. It is demanding, exhausting work that really requires immense dedication to your patients. Next up, part 5, career growth and income. Basically, let's talk about the return on all that investment. When you're just starting out, the approximate salary of an early career Unani physician falls somewhere between 15,600 and 39,100 Indian rupees per month. Again, baseline estimates subject to change, but it gives you a really clear financial starting block. And this brilliantly illustrates exactly where that starting block leads. You do not stay at the entry level forever. You start as an intern, absorbing all that vital practical knowledge. With a bit of experience, you become a fully fledged Unani physician. As you build up a decade of expertise, you transition into a senior Unani physician role. And ultimately, for those with leadership ambitions, you can rise all the way to become the head of the department. The upward trajectory is completely mapped out for you. Finally, Part 6, Real-World Success Stories. Let's look at some real-world proof of concept. I want to introduce you to Dr. Yasser Arafat. He is a prominent, shining example from the field, not just a practicing Unani doctor, but also a heavily recognized healthcare orator and an author. According to our source material, he successfully navigated that exact rigorous educational pathway we discussed earlier, eventually earning his BUMS degree from the Government Unani and Ayurvedic College in Dhaka. Dr. Arafat's philosophy honestly serves as an inspiring testimonial for this entire career. He strongly believes that a proper diagnosis at an early stage, followed by the appropriate treatment through the Unani system of medicine, yields effective and remarkable results. And the kicker? He emphasizes this happens with absolutely no side effects. It's just a powerful reminder of the profound, positive impact you can literally have on patient health in this role. So, we've covered the intense education, the financial realities, the demanding schedule, and the incredible ultimate rewards of this unique medical path. I want to leave you with this final thought to reflect on. Do you have the intense attention to detail, the deep desire to help, and the problem-solving traits required to take that very first step? The path to becoming a Unani doctor is clearly laid out right in front of you. The only question now is, are you ready to walk it and transform patient care?